Welcome back. My next guest is Dr. Eric Schafer, who's with Bluegrass Orthopedics, and you're an orthopedic surgeon who specializes in hip and knee.
That's right.
Welcome. We appreciate you coming in.
Oh, thanks for having me.
Well, now I started off with arthritic or hip pain, but when you say hip pain, I mean a lot of people say, "Oh, it's out here, it's my buttocks, it's my back." I mean, how do you know it's your hip?
Well, so there are a lot of things around the hip that can cause pain. And so if you're having pain from arthritis in your hip, the most common place that you feel it is actually right in the groin. So you often feel it deep in the groin. It wraps around almost like a tight belt of pain across the top of your thigh. And that's because the hip joint really is so deep into the pelvis. A lot of folks, they do have pain on the outside of the hip, and that can be more bursitis, tendonitis, or even coming from their low back.
So who would be a typical person that ends up with a bad hip that's got to be replaced?
Well, so the most common cause of hip arthritis is osteoarthritis, and we like to look at that as a wear and tear disease. Over time, the cartilage around a healthy joint can wear out, bone spurs can form, and the bones can start rubbing on themselves. So that's certainly the most common cause, but then there's post-traumatic arthritis, rheumatoid, or other inflammatory arthritis causes of hip pain that can also lead to a hip replacement.
So when you get the hip pain, how do you know it's time for a hip replacement?
Well, so that's what I look at is the beauty of orthopedics. Is so if you have hip pain, and come in to see us, and we can certainly walk you through all the non-operative treatments. But if your hip is arthritic, and if you've done all those non-operative treatments, and if you really can't live your life the way you want to, then there's a great surgical options for you, which is a hip replacement. But the beauty of it, it's an elective surgery, so it's very patient-directed in terms of when you're ready for it.
Well, now, I mentioned there's different options in terms of surgery. There's different ways to do the surgery. I'm assuming different hips. Tell us a little bit about the options.
So there's plenty of different options, from surgical approaches to the types of implants that we use. Of course, the one thing that we really like to focus on is how do we do the surgery with less pain for patients to recover quicker. And there's been some pretty good evidence that an anterior approach that spares some muscle can help folks recover quicker inside the first 6 weeks after surgery. But that being said, there's also posterior approaches, there's limited posterior approaches, and outside of 6 weeks, folks are doing just as well from all those different approaches. So the real goal that I like to say is that we do a good quality surgery with the right indications to really help folks get back on their feet and live their life.
When you say back on their feet, give me a little bit of idea what's recovery like. I mean, you walking the next day?
Well, so most people are surprised to find out you're walking the same day from surgery. So a lot of folks can go home the same day of surgery, and they can walk right to their car, they walk into their house. My typical recovery is I'd like to have you on a walker for 2 weeks and walking around your house, really taking it easy. For some folks, they're actually surprised at how hard it is to take it easy, especially for younger, more active folks. They want to get up and start moving. But for the first 2 weeks on a walker, for the next couple weeks, you're just slowly transitioning back to what you want to be doing. And then we say back to what you want to be doing by 6 to 12 weeks after surgery.
Now, are there different types of hips, and how long does a hip last, and what's the expectation?
Well, so there's certainly different types of hips from a technical standpoint. Sometimes we just press fit the hip into place so the bone grows into the implant, and sometimes we do cement it into place if we're more concerned about fractures or things like that. But the good news is both of those hip replacements have very good track records and can last very, very long, on the order of 15 to 20 years.
Now, you also deal with problematic hips. What are some of the problems that you may address for a tough hip?
Well, if we look at, hip replacements now, they've been done for so long, and our indications are expanding. So we've done them for younger patients who are certainly living longer. And so you do see some hip replacements over time loosen or unfortunately become infected. And so as we're doing more of those, then we're also running into the bigger problems, taking care of those. And so that's one thing that I'm really excited about to help folks out. Those are challenging problems, infections and loosening, and they may require another surgery. Luckily, it's a very, very small percentage of folks who get those, but the folks who do get those need specialized care, and we're happy to do that for them.
Well, I appreciate all the work you do, and thank you for coming in and giving us the information.
Thank you.
That's right. And if you've got hip problems, Bluegrass Orthopedics can help. We'll be right back.